Welcome to Health Insights, where we delve into the latest health tips and information to help you live your best life. Today we're talking about something incredibly important: 15 signs of underlying health problems. Let's get started. Before we dive into the signs, let's clarify what we mean by underlying health problems. These are conditions or diseases that may not be immediately obvious but can manifest through various symptoms. For example, high blood pressure, diabetes, or even certain cancers can exist without showing obvious signs until they progress. Detecting these signs early can lead to more effective treatment and better health outcomes. Now, let's explore the 15 signs that might indicate an underlying health issue and what you can do before seeking medical help. 1. Persistent fatigue. If you're constantly tired despite getting enough sleep, it might be more than just a busy lifestyle. Persistent fatigue can be a sign of anemia, where the body lacks enough healthy red blood cells to carry adequate oxygen to tissues, or thyroid disorders, which affect your metabolism. Chronic fatigue syndrome, a condition characterized by extreme tiredness that doesn't improve with rest, is another possibility. Recommendations: ensure you get quality sleep by maintaining a regular sleep schedule. Reduce stress through relaxation techniques like meditation or yoga. Improve your diet with iron-rich foods and stay hydrated. 1. Unexplained weight loss. Losing weight without trying can seem like a dream come true, but it can also signal problems like hyperthyroidism, where an overactive thyroid speeds up metabolism, diabetes, which affects how your body uses sugar, or even cancer, where the body's resources are diverted to fight the disease. Gastrointestinal disorders like Crohn's disease or celiac disease that affect nutrient absorption are also possibilities. Recommendations: track your diet and physical activity to identify any changes. Increase calorie intake with nutritious, high-calorie foods. Monitor for other symptoms like digestive issues or changes in appetite. 3. Frequent infections. Getting sick often, especially with recurrent infections, might indicate an immune system disorder or chronic disease like diabetes. Diabetes can weaken your immune system, making you more susceptible to infections. Primary immunodeficiency disorders, which are genetic, can also be a cause. Recommendations: boost your immune system with a healthy diet rich in fruits and vegetables. Practice good hygiene, like regular hand washing. Get adequate rest and manage stress. 4. Shortness of breath. If you find yourself gasping for air after minimal exertion, it could be a sign of heart disease, asthma, or chronic obstructive pulmonary disease, COPD. Heart disease can reduce the heart's ability to pump blood effectively, while asthma and COPD affect the airways. Anemia can also cause shortness of breath because your blood can't carry enough oxygen. Recommendations: practice deep breathing exercises to improve lung capacity. Reduce exposure to allergens or irritants that might affect your breathing. Quit smoking if you smoke, and avoid second-hand smoke. 5. Changes in bowel habits. Persistent constipation, diarrhea, or changes in stool color can be symptoms of digestive disorders, such as irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, like Crohn's disease or ulcerative colitis, or even colorectal cancer. Blood in the stool, persistent abdominal pain, and unexplained weight loss are particularly concerning. Recommendations: increase fiber intake through fruits, vegetables, and whole grains. Stay hydrated by drinking plenty of water. Keep a food diary to identify any triggers. 6. Skin changes. New moles, persistent rashes, or non-healing sores should never be ignored, as they can indicate skin cancer or other serious conditions like psoriasis or eczema. Changes in skin texture or color, yellowing of the skin, jaundice, or darkening around the neck and armpits, acanthosis nigricans, can also signal underlying health issues like liver disease or diabetes. Recommendations: use gentle skincare products and avoid known irritants. Protect your skin from the sun with sunscreen and clothing. Keep the affected area clean and moistured. 7. Persistent cough or hoarseness. A chronic cough or hoarse voice that lasts more than a few weeks could be a sign of respiratory conditions like chronic bronchitis or even lung cancer. Gastroesophageal reflux disease, GERD, where stomach acid irritates the esophagus, can also cause a persistent cough and hoarseness. Recommendations: stay hydrated to soothe your throat. Use a humidifier to keep the air moist. Avoid smoking and reduce exposure to pollutants. 8. Sudden confusion or memory loss. Experiencing sudden confusion, memory loss, or difficulty concentrating can be alarming and may point to neurological conditions like Alzheimer's disease, stroke, or transient ischemic attacks, mini-strokes. Metabolic issues such as severe dehydration, electrolyte imbalances, or low blood sugar, hypoglycemia, can also cause these symptoms. Recommendations: ensure you're well hydrated and eating regular, balanced meals. Reduce alcohol intake and avoid drugs that impair cognitive function. Engage in brain-stimulating activities like puzzles or reading. 9. Chest pain. Chest pain isn't always related to heart attacks. It can also be caused by gastrointestinal issues like acid reflux or gallbladder disease, anxiety or panic attacks, or musculoskeletal problems like costochondritis, inflammation of the cartilage in the rib cage. Recommendations: try to relax and reduce stress levels. Avoid heavy meals and known food triggers if you suspect acid reflux. Monitor the pain and note any activities or foods that exacerbate it. 10. Swelling in legs or feet. Swelling in your lower extremities, known as edema, could be a sign of circulatory problems, heart failure, or kidney disease. When the heart or kidneys aren't functioning properly, fluid can build up in your tissues. Liver disease can also cause swelling due to low levels of albumin, a protein that helps keep fluid in your bloodstream. Recommendations: elevate your legs when resting. Reduce salt intake to minimize fluid retention. Wear compression stockings to improve circulation. 11. Persistent headaches. Chronic headaches can indicate various health problems, from tension and migraines to more serious conditions like hypertension or a brain tumor. Stress, poor posture, and dehydration are common causes. Recommendations: stay hydrated and avoid caffeine and alcohol. Practice good posture to reduce tension headaches. Use over-the-counter pain relief if necessary. 12. Frequent urination. Needing to urinate often can be a sign of several conditions including urinary tract infections, UTIs, diabetes, or an overactive bladder. Increased thirst and frequent urination together can often signal diabetes. Recommendations: limit caffeine and alcohol intake. Monitor your fluid intake and try not to drink too much before bedtime. Maintain good hygiene to prevent infections. 13. Dry mouth or excessive thirst. A persistently dry mouth or excessive thirst can indicate underlying issues such as diabetes, Sjogren's syndrome, an autoimmune disorder, or certain medications. Recommendations: drink plenty of water throughout the day. Use a humidifier to keep the air moist. Chew sugar-free gum to stimulate saliva production. 14. Unexplained bruising. Bruising easily can be a sign of underlying health problems like vitamin deficiencies, particularly C and K, blood clotting disorders, or even leukemia. Recommendations: ensure you're getting enough vitamin C and K. Avoid taking blood-thinning medications without a doctor's advice. Protect yourself from injuries by wearing protective gear. 15. Numbness or tingling. Persistent numbness or tingling sensations, particularly in the extremities, should not be ignored. This can be caused by nerve compression, like carpal tunnel syndrome, diabetes, or even multiple sclerosis. Recommendations: ensure you maintain good posture to avoid pinching nerves. Stretch regularly and avoid repetitive movements that strain your body. Ensure your diet includes sufficient vitamins, particularly B vitamins. Remember, Experiencing one or more of these signs doesn't necessarily mean you have an underlying health problem, but it's important to consult with a healthcare professional to rule out any serious conditions. Early detection and treatment are key to maintaining good health. Thanks for tuning in to Health Insights. If you found this information helpful, don't forget to like, share, and subscribe. Stay healthy and take care of yourselves.